Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about having histamine reactions or having increased levels of histamine in the body after starting a new medication. And this could be from a pharmaceutical medication or from a non-pharmaceutical medication. So someone posted a question about this, and it's an interesting topic. They were specifically asking about a blood pressure medication leading to increased histamine levels in the body, and what they might consider doing about that. So kind of a general rule, whether it's a prescription medication or it's a non-prescription medication, you should really talk to the clinician who prescribed it for you about possibly finding an alternative to that or figuring out some way to mitigate the side effects from that. Unfortunately, a lot of clinicians are not very histamine literate, so to speak, or histamine savvy, if you will, and so they might not be really aware of what that might actually mean. Unfortunately, their mast cell activation syndrome and histamine intolerance are not taught as a standard part of the curriculum in any medical school, to my knowledge, whether it's conventional medicine or naturopathic medicine, chiropractic. I know when I'm lecturing to students at the Canadian College of Naturopathic Medicine, where I did my degree in Ontario, I do mention histamine issues as best I can, but it's not an official part of the curriculum there either. So the long and short of it is that if a person's reacting to a medication that is able to be changed out for something else, then just changing out that medication would probably be the simplest thing to do if the prescribing clinician is on board with that and there's a safe alternative. If it's not feasible, if a person is just they have to be on a certain type of medication and there's no alternatives to it whatsoever, then in that case, unfortunately, it turns into a damage control kind of scenario where, of course, hopefully someone's working with that patient to help address the root causes causes of why they might have the mast cell activation in the first place, or what might be driving their histamine intolerance, whether it's genetic polymorphisms that can be supported with certain nutritional cofactors, or it's working with a low histamine diet, or at least a lower histamine diet. And then, of course, there could be, and then in addition to working with root cause factor treatment, then also working with things to help try to just mitigate the release of histamine in the first place. So whether that's using things like quercetin or other mast cell stabilizers. One of the things that I've been finding in my practice that's been very interesting, and I haven't been able to find research that supports. I'll start again. One of the things that I've been finding really useful in my practice has been glutathione, and I think that it is working to help stabilize mast cells. I've dug through the literature to some extent in my free time or my research time, and I haven't been able to find any studies that specifically tout glutathione as being a mast cell stabilizer, but it does make a lot of sense to me that it would stabilize mast cells, because mast cells, like all cells in our bodies, have a cell membrane, and those cell membranes, if they are oxidized, so if there's not enough antioxidant content kicking around, then they can become more labile, more friable, easier to poke and prod, and possibly cause a cellular degranulation, releasing a bunch of histamine and other pro-allergic mediators. And so clinically, I've actually been finding that glutathione, when it's liposomal and dosed appropriately, has actually been working really well for a number of my patients. Of course, it's not a panacea. Of course, only take things that are prescribed by your clinician. And also, if you talk to your clinician saying, hey, this guy on Instagram or Facebook, wherever you're watching this video, said, hey, glutathione could be really helpful. If your clinician's not overly familiar with prescribing glutathione, just bear in mind that glutathione is really, really strong. It can get detox pathways upregulate, or it can help to upregulate the rate at which your body is detoxifying, and it can have sometimes unintended side effects if it's used at the too high of a dose too quickly, or in the wrong patient. Anyways, using mast cell stabilizers can be very helpful. Sometimes using over-the-counter medications like Reactin or Claritin, or I don't remember what they're called in the States, but cetirizine being the sort of the non commercial name for it, so to speak. Anyways, using those types of histamine receptor blockers can be useful. Again, you need to talk to your clinician about specific advice for those types of things. So it's either hopefully being able to switch out the offending agent with something else, or it's damage control if the medication is just immovable thing, like an unalterable thing. So I hope that answered the question. If you have any follow-up questions to what I've said here, feel free to post it in the comment section. And if anybody has any questions about anything else, then don't hesitate to ask.